I didn't want to be a nurse. My mom was a nurse. God ordered my steps. Like what I
Yeah.
thought I didn't want actually became what I needed to be. I started to have some infant losses that like really rocked my spirit, rocked my faith. And I felt like some of them were avoidable. I felt like if we had wrapped around the community better, I wouldn't be seeing the amount of deaths that I was experiencing. The Michigan Legislative Black Caucus, they were one of my first groups of leaders that I sought out to speak to. And they were like, well, Carlie, truly from a caucus standpoint, we don't get to talk to nurses. You're the first nurse we've ever spoken to. And they're like, we see physicians, we don't see nurses. And that really struck me to my core, where I was like, wow, where are we? I feel like if we spent half as much time as we did about how we engage with other professionals within the healthcare frontline space as we did on our voice, our power, advocacy, we would walk into spaces immediately knowing our worth. We would walk into spaces knowing how to create a table that invited people. We would walk into spaces knowing how to carve out intentionality around our lived experiences and threading them into solutions.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Hello again, and welcome to the Nurse on Purpose podcast, where we challenge media stereotypes of nursing and really shine a spotlight on the incredible role of nurses every day. Joining me today is Carlie Austin. Carlie is a remarkable leader. She's an advocate, and she is an innovator in both the fields of nursing, maternal and infant health, and public health policy. Carlie balances numerous influential roles, and I'm talking numerous, with passion, with commitment, and with an unwavering dedication to improving health outcomes for vulnerable and marginalized communities. That is her passion. She serves as the Executive Director of Strategy and Advocacy, in addition to being a neonatal ICU nurse. She's also a PhD candidate in the College of Nursing and the Bridge Graduate Certificate in Public Health in the College of Medicine at Wayne State University, where her research focuses on the intersection of hospital quality disparities and health inequities, particularly as they impact Black infant health outcomes in obstetric and neonatal care settings. Anyone who knows Carlie can attest to her fierce advocacy for the nursing profession and the populations she serves. I've seen it, and I can attest to it. She has been recognized with prestigious awards for her clinical care and for her leadership, and also for spearheading several Black maternal health events and initiatives to address systemic issues that shape maternal and infant health. It is my pleasure today to welcome Carlie Austin to the podcast. Carlie, you're so welcome.
Thank you. No, I appreciate that. I am honored, absolutely honored to be here.
Wonderful. Thank you so much for joining me. You know what? I want to first of all ask you, how do you balance all of these roles together? You're so young, you're so accomplished, like somebody did something right somewhere. But how do you balance all of it? And what is at the root of your passion?
I think balance is probably a really loose word. I'm probably not as balanced as people would like to think. I survive. I get about 3 hours or so on average.
Oh, goodness.
And then everything from there is just like pure momentum. So I think I'm just like blessed. I was just having this conversation earlier when someone's like, hey, do you want a cup of coffee? And I was like, oh, I don't drink coffee. And they're like, wait, but I know you and I know all that you accomplished. So you mean to tell me in your, 20 plus hours of a day, you do not drink coffee? What do you do? And I'm like, I don't know. I think most of it is like I have to get something done. Right. And so it's on a timeline. So I'm going to get it done. The things that are like above and beyond my responsibilities, which are many, I absolutely, I guess I feel like I know that I am working towards something in these just
Mm-hmm.
like my sacrificial years.
Mm-hmm.
And I'm willing to do that. But I guess from a balanced perspective, I miss out on a few things, and those are
Yeah.
usually social. But like I said, I feel like these are my sacrificial years. And if I build the foundation strong, I'll sort of
Mm-hmm.
reap what I've sown at a later period of time where
Mm-hmm.
it's not just me reaping that. Those are the individuals that are in my family, the community, that I
Mm-hmm.
love dearly. And I think that will have greater appreciation for maybe me missing a birthday party or, a family reunion outing, which I'm starting to realize more and more now that I need to carve out better space for that so that I am balanced. But
Yeah.
I think I get all those things done at the expense of something else.
Yeah.
But
Yeah.
yeah.
I love that you said that sacrificial years, we all experience that at some point, whether it's when you're working on vision in school, whether it's motherhood, like there's something that will inevitably take priority over other things. And even when you're trying to balance it, you'll still be giving like 80% to the things that are more important. There's never ever going to be everyone gets a 50-50 share because some things would just take precedence in your life. That's just the way life rolls. But I want to talk about your passion. I know that this is something you feel really strongly about is addressing healthcare disparities, especially in neonatal populations, maternal health populations. Can you talk to me about that? And then we'll come back to how you even got into nursing and into the NICU world to begin with. But let's talk about that.
I think it was probably formally 2019.
Mm-hmm.
So when I was starting to feel, and it might have even been like right before 2019, maybe 2018, when I was starting to feel like, hey, I'm going into this environment to care for marginalized and vulnerable infants for a reason. And I think during my immersion, when I first got exposed to this particular unit at Children's Hospital of Michigan, it was so dynamic. Like I was just watching nurses operate at the top of their license, the way that they partner with physicians, the way that they would run codes, the way that they engage with families. Like they weren't just technically intelligent and impressive, like humanistically, they had the entire package. And I felt like if I'm there, I will be the best version of what I envision myself to be. And when I started as a nurse, not operating with a preceptor or a mentor, and I'm just out there on my own, the beginning stages they were great. Like they kind of mimicked what I experienced during my immersion. But then I started to have some infant losses that like really, rocked my spirit, rocked my faith, and I felt like some of them were avoidable, not necessarily in our capacity to do work at that period of time, but just from a multi-sectoral standpoint. I felt like if we had wrapped around the community better in certain regards, I wouldn't be seeing the amount of deaths that I was experiencing. And I mean, I'm at a level 4 NICU. And so when you look at it statistically, yes, that's representative of almost what, 1, maybe 2% of our
Mm-hmm.
population. But when you're living it day to day, it doesn't feel like 1 or 2%. It feels
Yeah.
very large. And so
Right.
I was feeling like what I envisioned entering in as a novice nurse, 20 years old.
Mm-hmm.
I felt like what I was actually able to do wasn't in alignment with what I wanted to do. And I think
Mm.
COVID hit some of that, like from an organizational cultural standpoint and what was being prioritized and the resources that we were being given as a safety net institution, it amplified, like I said, that alignment.
Yeah.
And so instead of feeling like I was getting ready to exit the bedside, which is how I felt very defeated.
Mm-hmm.
And it wasn't more, we hear a lot about burnout. It wasn't necessarily burnout that was driving me to feel this way as far as exit. It was more along the lines of the moral injury aspect. And I was feeling as though like my moral compass, my vision, my passion for what I wanted to do in this role as a bedside nurse, specific to this community, I was not able to do. And it was really outside of my capacity of advocacy at the bedside, outside of my capacity of advocacy to managers, to engagement on shared governance committees. Like I felt like whatever I had done within the hospital still had a ceiling. And I had to figure out how
Mm.
I navigate what felt like my commitment to a community that I was forsaking. And I had to learn that, like, where did that deep sense of guilt come from? Where I felt like if I left, now a community is failing or a system is failing. I'm really still not quite sure where that
Mhm.
came from, but I felt it, right? And sometimes I still feel it, like when I'm doing a million and one things, like, is it really tailoring into what I'm seeing as being tangible impact to a community that I feel deeply compassionate about serving? And so I ended up going the advocacy route outside of the system, because I feel like sometimes as a clinician, as a frontline staff nurse, you think your greatest voice is at the immediate bedside, or you think your greatest agency to change is within the system. And sometimes
Yeah.
that system is working within macro politics of its in itself. And
Mhm.
so I started like, well, how do I get out of the system to fix inside of the system? And so
Mhm.
I started working with local municipal leaders. I started like those that
Mm.
represent the district, instead of it being facing a hospital or facing systems of resources. I started making the narrative completely centered around the patients in in the community, because
Mm.
aside from whether or not they're consumers of a particular health system, they're your constituents, and this
Yeah.
problem is pervasive in a community. So that started being how I narrated a problem that I felt like if it was fixed at this level, that would trickle down to how I deliver care at the front lines. And so, like I said, I started from the local municipal leaders. I started talking to individuals from city council. I started talking to the reps and senators that represented that particular district. And then I started saying, how do I get a broader seat at a table through these advocacy experiences? And a lot of individuals had, you know, research degrees like doctorates or JDs or business. And at the time, it felt like the most feasible pathway to a seat at the table was through getting my PhD. And so
Mm.
that was naive, because it's been a trek. I'll tell you that. It was probably an
Talk about
easier
that.
pathway that I just did not know. But through that,
Mm.
I got exposed to what's called Science Policy Detroit, which is an advocacy organization that is through Wayne State. And it allows you to take your research and your lived experiences and intersectionalities and advocate at your state level about bills that either align with your work
Mm.
or they are out of alignment, and you want to help your key stakeholders from a policy standpoint understand the
Mhm.
adverse impacts to your work in the community. And from there, I got a bunch of different opportunities professionally, which landed me through what we talked about before, the Michigan Health and Hospital Association, as their maternal and infant health policy specialist. And I just feel like the world opened up there for me professionally through advocacy, understanding not just policy, but politics and all of it. So I hope that answered it. I do want to be cognizant of the time, but
No, no, you're
we can
fine.
talk a little bit more
Yeah.
about that within the segment.
Understood. Yeah, that's perfect. When you were meeting with these policymakers in your locale, what was your message to them? Because I'm guessing they're not in healthcare, and I have viewers or an audience who also doesn't have a healthcare background. So, in simple terms, what was your message to them? What were you fighting for? What were you advocating for?
That's a really good question. So, the Michigan Legislative Black Caucus they were one of my first, I guess, like groups of leaders that I sought out to speak to, because my advocacy and passion point that I was presenting to them was around Black infant health outcomes and Black maternal health outcomes, and the egregious rates of Black infants in that particular area dying at sometimes 3 to 4 times the rate of white infants, as well as their mothers. And so, one, I just wanted to present like, hey, this is the scope of the problem. Are you aware? And many of them were aware, right? They might not have been aware of the detailed minutia of the statistics, but they were aware of the vast community disparities in the health outcomes shaping that, not just from a social determinants, um,
Standpoint?
non-healthcare access standpoint,
Mm-hmm.
but like all of it, right? Like they had
Mm-hmm.
a sound baseline understanding. And so I thought, well, then what's our problem? right? If we all know the problem, why aren't we getting to a place where we
Doing
can
more to
see
fix.
marginal changes, right?
Yeah.
From resource allocation into communities, from healthcare access to education to pipelines from poverty and homelessness. Like, what are these things that you guys are working on? And they were like, well, Carlie, truly from a caucus standpoint, we don't get to talk to nurses. You're the first nurse we've ever spoken to. And they're
Mm.
like, and you're, being the first nurse should also let you know that you're the first Black nurse to reach out to us about problems that you're seeing facing a community from a health perspective, clinically, in your need and desire to like have a distribution and allocation of resources that are not just equal but equitable. Like, we see physicians, we don't see nurses. And that really struck me to my core, right? Where I was like, wow, where are we? Right? Where are we at a city level? Where are we at a state level? And why aren't we engaging? And why aren't you finding different pathways to engage us? Like, where's the disconnect where we meet in the middle? Because a lot of nurses, obviously, they're working 12-hour shifts. Some of them are working 16-hour shifts, 3 to 4
Mhm.
times a week. It's not easy for them to get to their state capital. But
Yeah.
some of these caucus members are intimately, through like their offices, their local offices are throughout the city as well. And so I'm like, well, why aren't we finding different ways of engagement where we can be helpful to you, you can be helpful to us, and this is how we can meaningfully serve our community from a partnership and collaboration standpoint. And the vice chair was like, I'm going to put you in front of all of them, right? I want you to talk about this. I think you're dynamic. I think you're passionate. I think you don't realize how the fight that we fight at a state level requires us to have support. It's not
Mm.
just our voice, our vote on a particular issue. It requires us to have people behind us to get momentum,
Behind us who know the stuff.
who know exactly. And I was like, bet I will be the people behind you.
She said
I,
that.
I will get people there with you. And it just, it kind of took off from there. So that is how I would say one of the first striking points, if I ever look back on how I was able to get involved, meet individuals that are definitely advocating about the issues at a legislative level that impact our communities, where I understood the disconnect, like the immense disconnect between nursing and advocacy and policy beyond the four walls of the hospital. And from that moment on, I promised myself and I promised that representative that I will always make sure to be a touch point for you, because I believe that deeply in our ability to make change when we connect with one another appropriately. Um,
Yeah. Yeah. Thank you for sharing that. I recently attended a Maryland Nurses Association event. It was a legislative night. And we had so many Congress people come and talk about their experiences. And they addressed the nurses and they said, we want to hear from you. We don't know what you know. So don't diminish the power of your voice, your expertise, your experiences, because when we push these health bills, I mean, half the time we're just pushing it without enough knowledge or insight into what it is that we're fighting for. But when we hear your voices and you speak out and tell us what you really need, what are some of your pain points, like you mentioned, it really helps us to push these things with more passion and with more gusto. And so they really do want to hear our voices. They want to hear from us. But I think where we struggle is being present in these spaces. We just feel like there are some spaces that we belong and some that we don't belong, but that's not the case. We belong in every place that healthcare decisions are being made because they will affect us as nurses. So very glad that you mentioned that, and just really trying to get people involved more in advocacy. I'm sure people that are connected with you are like, if you're friends with Carlie, you're going to be advocate one way or another. I'm impressed with that. Okay, so you mentioned it. I'm going to come back to this. I know you mentioned it. You talked about the PhD not being the only path. Like, you thought it was the easier path to get your foot in the door of advocacy and policy. Can you tell us what other path there is, and why did you feel like PhD was not the...
I mean, you know, I probably wouldn't have learned this without the PhD path. However, what I'll say is, my goal was to get a seat at the table. That's what I was essentially saying before. But I think what I've learned since that initial thought is that you don't need a seat at someone's table, right? You can start with building your own and inviting people to yours. And I
Right.
think sometimes we wait for that moment, or we work to get the next thing that makes us suitable to be sought out.
Oh,
And
yeah,
nurses are already suitable to be sought out, right? And
absolutely.
similar to your point that you just made, these individuals said, "No, we want to hear from you." That's what I was hearing. They're like, "Carlie, we want to hear from nurses." They just didn't know how.
How?
So sometimes at a grassroots level, as nurses on the front lines, we can create our own table and invite the individuals we want to ours, give them a seat, tell them about,
Yeah,
like you said, those pain points, those wins, the disconnects, hearing about different legislative changes. This is how we would like to weigh in on that. Is there a formal way
yeah.
in which we can stay in touch? And I think that doesn't require you to go get any additional degrees.
Thank
That
you.
doesn't require you to have a
Hmm.
badge of honor that says now you
Hmm.
have a
Hmm.
ticket of entry. You are the badge
Hmm.
of honor by simply being the
Yes.
issue expert about your
Yes.
community from a health perspective, right? And
Yeah.
like you said, a
Yeah.
lot of them don't have healthcare backgrounds. A lot of them have to do the job at hand, which may require them to push something that they have limited information on, and they're only going to go with the scope of expertise that they have. And if it's not
Yeah.
us, right, then it's probably not fully informed, is what I'll say.
Yes.
And so,
Yeah.
from a frontline clinical nurse perspective, I do hear a lot of nurses say, nope, not interested in policy, not interested in politics, not like all of that. Put that to the side. That's not why I became a nurse. But we have to realize whether or not um, we see policy in our day-to-day work, it is impacting us, and you are seeing it in your
Day
day-to-day
to day.
work. You're just
Yeah.
not noticing it, right?
Yes.
So ignoring it never made the job easier.
Right.
I think the way that we narrate it from an undergrad touch point all the way through to whatever higher learning, whether that's a master's or doctorates in nursing, the way that we thread that in. I remember being an undergrad and people like telling you how to speak to physicians. Like they were really focused on decorum, how to deal with, if a order isn't what you think it should be, how to conduct yourself regarding that. If you need to deal with being mistreated as a nurse, this is how you. And I feel like if we spent half as much time as we did about how we engage with other professionals within the healthcare frontline space, as we did on our voice, our power, advocacy, how politics influences systematic change. If we did that, we would walk into spaces immediately knowing our worth. We would walk into spaces
Absolutely.
knowing how to create a table that invited people. We would walk into spaces knowing how to carve out intentionality around our lived experiences and threading them into solutions, right? It's not
Absolutely.
about just bringing your pain and talking about a problem. We
Yeah.
also know the solutions, right? Because those closest to the problem are often closest to the solution, and that's
Yep.
us. And I
Yep.
think we have to live in that. I think we shy away from wanting to take that stage sometimes,
Mm.
but that
Mm-hmm.
stage belongs to us. And if we don't take it, we miss our moments. And we have to reorganize our minds to realizing that it's not about us taking center stage. It's about putting our patients center stage, who are often siloed, their voices are
Yeah.
marginalized. And
Yeah.
when we step in that space, we're bringing them with us, right? And so it's not about us as a profession. And I hear a lot now, like people just want to kind of take this moment and excel themselves, right, in the name
Mm.
of the profession. And
Mm-hmm.
that's what it's never been about. It's always been
Mm-hmm.
about the individuals that we serve. And we have to know that we have to serve ourselves to be whole first. And that takes policy and advocacy as well, if we're ever going to serve a community. It
Absolutely.
can be done on 3 hours of sleep, but also you need to fill your cup, right? You need to fill your cup.
Yep.
I don't advertise forsaking self. I advertise
Yes.
filling your cup first, because that is the only way you can continuously give out. And this profession has been suited in a way that we're supposed to give out first and think of self later. And
Mm.
that is not advocacy. That
Yeah.
is detrimental to all involved. And so
Yeah.
I think that would just be kind of what I say to that. We have to live in our power. There are different pathways. Then by all means, get another
Hmm.
degree. By all means, but let it
Hmm.
be a means to something. It just
Right.
I always say my degree was never to be, performative and, oh, someone's going to say Dr. Austin. I could honestly care less. I really
Hmm.
personally, that's
Hmm.
not why I got it. I got it
Yeah.
because I felt like someone out there would take my lived experience and diminish it just by who I am and who I represent. And so getting a PhD gave me greater um,
Credibility and validation.
credibility, greater
Yes. Yes.
extent
Yes.
to a
Absolutely.
problem, that it's
Yeah.
not just us because it's us. This
Yeah.
is a social issue. This is a national issue. This is a
Yeah.
international issue. This is a human issue that if it's not you per se, it impacts you inadvertently because we're interconnected, right?
Yeah.
And I felt like
Absolutely.
that's what it gave me. And it really truly it has.
Thank you for sharing that because I do want to go back and get my PhD because of this passion that I feel for. Thanks for the claps. For the passion that I feel for media stereotypes about nursing and just elevating the profession in general. And so it's nice to hear that. And of course, I don't have my PhD now, but it doesn't stop me from using my voice and using this podcast, right? I don't have to have a PhD behind my name. And I think that's what you're alluding to, that
Absolutely.
wherever you are, with whatever you have, what you need is the passion, right? That's the first thing. So you have to know what you're fighting for, what you're willing to risk it all for. And then you can start in whatever small capacity and build on that. It's because you chose to use your voice. You could have been like, oh, I'm young, I don't really have that much experience. But you stepped out of your comfort zone. And this politician was like, yeah, we've been waiting on you. We need that. And I'm going to put you in front of everyone. And that's really what advocacy is. It's pick a topic that really you feel led to change, you feel led to pursue and make an impact in, and then just start small wherever you are. You said grassroots. Start with what you have and doors will start to open because you're doing it from a place of passion. But really proud of you for going for your PhD and making your focus on kind of improving healthcare policies and systems. How long is that program for
So the
you?
program, I think the program can, I believe, max to 7, 8 years if you get an
Oh, good
extension
grief.
for whatever extenuating circumstances. For me, I was BSN to PhD, or I am BSN to PhD, and so I wanted to always get done in 4 years. Like that
Yeah.
seemed like a feasible goal for me. I did
Yeah.
not feel the need to stay anywhere 5 years. Like I would just lose my mind. But actually when you count that I've been going all year round, so
Yeah.
no summers off, it really is 5 years and I didn't really
Yeah.
see it that way before
Yeah.
entering the program. But for me, I was really on track to graduate this December. So that would have been, I met my, set goal for myself within that 4 or 5 year time frame, if you're counting the summers. Uh, Given that my work is health equity work, and I'm looking at the way that systems influence the Black white infant mortality gap by looking at quality access to care and or lack thereof, like the differences and the disparities across systems. The current climate of research and funding research that has really anything to do with those topics have been challenging. And
Yeah.
some of those funding mechanisms and opportunities influenced my ability to finish at that December deadline. So I will likely navigate into the January 2026 timeframe, but that will be all, right? I have no
Yeah.
other, God willing, that would be it. I had a conversation with my advisor who's like, Carlie, I don't know why you like put so much pressure on yourself to finish at this time. Like you're doing well. Like look at how quickly you're getting things done. You're
Yeah.
balancing life, you're working 2 jobs, like you should just take a moment and be in the moment. And I was,
Yeah.
I am in this moment, and in this moment I'm realizing I better be done by January 2020.
Like I'm done with school. It's 8 years
Yeah.
or 9 years at this point.
Absolutely. And I
Um,
think some of the sought out experiences, like I said, I probably would not have realized this to the magnitude that I have come to this realization if I did not pursue my PhD. But
yeah,
the amount of individuals without having PhD after my name that have reached out to me, it it shows me that they really are looking to seek out the expertise. They're really
yes,
looking to seek
absolutely.
out the like you said, the passion and
Yes,
the ability to and the desire to commit in partnership with individuals. Like they are seeking that out. And so I
yeah,
feel like once I started realizing that, I was really like, man, well then why do I need this PhD? Like I'm getting some of the experiences that I thought I needed the PhD to get, right? And
mhm,
the reason why I stayed in the program for two reasons, because I had a lot of personal challenges throughout this program. And one was just knowing how underrepresented we were as Black women in
yeah,
doctoral degrees. And so it felt like a plight of justice. Like just
hmm,
I can add myself to the narrative of we can do it, right?
hmm,
We can do it against all odds, and that
hmm,
felt really good to me. So I wanted to
hmm,
own that commitment and see that through. The second one was realizing how little we knew about this phenomena and
hmm,
understanding that our research, we can have evidence based policies. We can have these evidence based, legislative conversations that we're not making decisions off of our feelings, right? And
yeah.
our feelings are valid, but we can feel like we're being under resourced, disinvested. We can feel like we're pushed to the margins, and that's not enough for people to care.
We need fact
We need fact. We need
because
data.
data is king. Yep.
Absolutely. And so I felt like, wow, there's so little out there in the extant literature about this phenomena. This is my niche, this is my space. And it's
Hmm.
not going to take me 17 years to translate it into something that is actionable. I'm going to use what I've been given now as far as opportunities, culminate that with the research phenomena that I'm doing. And I'm going to apply pressure in different sectors,
Mm,
partnerships to see that tangible activity when I'm looking at eradicating racial disparities and inequities in neonatal and infant health outcomes. So that is why I stayed, because that PhD really, the whole experience of thinking, putting together an argument, engaging with data, how to synthesize it quickly, how to write up things that are bite-sized to your
hmm.
legislators, but that really hit home
Yeah.
to individuals that want to craft out frameworks that support systematic changes, not just these one, two siloed opportunities for change, like
Hmm.
true
Hmm.
collaborative multi-sectoral change that is generational. That is why I stayed.
That's wonderful. So, while you've been doing the research, what have been some pieces of information, of data that you have gathered to support the feelings that you were having while you were in the NICU as a nurse?
Awesome question. I've learned a lot about de facto segregation in healthcare. Not
Mhm.
something I really ever thought about entering into the role of a nurse and the specific NICU that I serve in. Once I started really getting intimate with the literature that I was seeing, starting to look nationally at how our hospitals are situated, who they predominantly serve, the structural underpinnings of those institutions, I really started to realize that like Black individuals are segregated to a few hospitals across our nation. And when I look at the makeup of my particular state in the city that I work in, it mimics that. And I think
Mm,
sometimes we spend a lot of time about social determinants of health and how that impacts individuals, people as a community, populations of individuals. And I feel like for the specific thing that I'm passionate about, which are inequities and disparities in health outcomes for Black individuals, specifically Black moms and Black infants, there's been a lot of what feels like blame placed on people to get themselves out of situations. pick better partners like fathers, be married, have a better income, be more immersed in education so that you don't have these bad health outcomes, eat better, do better, like that sort of narrative. And I think when you start to look at the same ways that structural racism has impacted people, it has impacted people that serve those people. So, meaning your nurses, your physicians, it has embodied the way that systems are impacted. And so I call it structural determinants of health systems, similar to how we have social determinants of
Of health.
individuals.
Mm-hmm.
When you look at the impact, the adverse impact and outcomes of disinvestment in communities of color, and you juxtapose that with the disinvestment of institutions that serve communities that are placed in communities of color, they mimic the very, very similar barriers and struggles. And
Mm.
when you think about the people that work within those systems, and they're often also the ones that you blame when you have these disparities in outcomes, I
Mm.
see limited conversation about resource, um, what's the word I'm looking for? Like opportunity of change from a resource allocated standpoint to do something differently within that capacity as a provider, within that capacity as an executive. And to be more specific, what I mean by that is you hear a lot of individuals say, the reason why Black moms are dying sometimes is because of biases and explicit racism, and those clinical providers aren't valuing, seeing, or hearing these individuals. And that is a really important part of the conversation. And it's also data informed. That is real
Yeah.
and happens. But the part that I didn't see anyone responding to or even investigating is why why do
Mm.
these individuals not have the capacity to make moms feel valued, seen, or heard? No one's
Mm.
asking that question.
Yeah.
I rarely see it. And so, as a nurse who can have a very different assignment as a Black serving institution and a Black serving community, and I'm learning over here in a white serving institution and a white serving community, they have very different capacities and allocation of resources to deliver care. It may look like I don't want to make my family member feel valued, seen, or heard. It may look like that and I was looking at a recent literature review from Krista Sergeson, and one of the statements made, and it was a qualitative, and I love that it was qualitative. One of the statements said, for Black families, sometimes the nurses are just strategic in avoiding us. They're strategic in how they narrate us as difficult or challenging. And sometimes it's because they have to kind of like parse apart what's important in that moment and then
Mm.
say, hey, this is a higher acuity need. And so we're not going over there, right? So there was a
Mm.
little thread in like, maybe it's not just because they're horrible nurses. Maybe it's because they're out of their capacity and scope to
Mm-hmm.
really engage us as partners in our care and really engage
Mm.
us as people versus a problem to be solved. But it was interesting that they're strategic in how they avoid us. And that is a sad narrative because I've been on the side where I have two kids' lives to save and I'm spread thin on the third. And that family who has a feeder grower and getting ready to go home, who used to have a very chronically ill infant, right? They still, and as they should, they still see their child as a child that their lives need to be saved, right? That's their priority, as it should be.
Priorities. Yeah.
Whereas for Whereas for me, I'm balancing all of these things, right? So I may not be able to show up and have communication with the mom the way that I want to, or the father, or whoever that family system is. I may not be able to hold the baby as long as I can, or support the feeds as much as I want, because I'm over here either maybe starting a line, giving blood, grabbing labs for ECMO. It could be a totally different exposure to environment that may make those families feel like they're not feeling valued, seen, or heard.
Yeah.
And it's not
Yeah.
because it's
Yeah.
Carlie didn't want to, it's because Carlie didn't have the capacity to carve it out. And I think sometimes we see the outcomes of these issues, and instead of asking why, we create, right? We create the answer before we really get curious
The
about the root
narrative
problem.
ourselves.
I think that was one of the main reasons why I took an interest in my phenomena of research is because I feel like it added a holistic perspective to know if we don't get the structure right, and if we don't understand the structure of healthcare right, we can never discern bad actors. Because we can always rely on, we just didn't have enough resources. We can always rely on, I was spread too thin, I had an inappropriate assignment. We can always rely on the part that might feel strategic to families. But until that's equal,
Yeah.
I haven't even mentioned equitable, until that's equal, until you have equal amount of nurses across hospitals serving the same patient populations, until you have equal resources to respond timely and effectively, until you have equal resources to sit and undo years of medical mistrust, until you have equal resources for technological advancements and wraparound services that meet the needs of patients and communities outside of the hospital, until you have that as equal, you can never discern whether or not it's truly rooted in biases and racism. And you can't tease that out. When we have that equal,
Yeah.
then there's no excuse. When you have
Yeah,
that
because
equal,
now
why didn't you sit
the
and be
playing field is
present?
level.
Exactly. The
Absolutely.
field is
Yeah.
equal. Now, equity
Equal.
takes us to do things to a greater level.
Yeah.
But for now, we don't even know what we need to be equal because we don't have enough
Yeah.
data informed touch points on that. So that is what I've learned is that looking at the literature, we're currently de facto segregated across our nation, and between the
Yeah.
hospitals that predominantly serve Black individuals and those hospitals that predominantly serve white individuals, we don't know enough about the structure and the inequalities and inequities of the structure that perpetuate us to do harm in a way that we're actually it's unintended in most regards, or in a way
Mhm.
that we don't aim to intend in most regards. And those that
Mhm.
do, we can't even identify you as bad actors unless it's explicit. So
Yes.
implicit is such a threaded needle that we can't really get to the rooted issue of until we get to the rooted issue of the structure. Uh, and
Thank,
that is what I've learned.
thank you.
You're welcome.
Um, I'm so taken by your passion. It's striking. And I remember when you said you wanted to be a disruptive voice in a world where people feel defeated right now, right? Because of the changes in policies that have long served to protect our best interests. And you wanted to give power to the voices that feel siloed. And that really stuck with me. And it's not every day that somebody wants to be the one that rises up and takes on that challenge. And so I'm so impressed and so proud that you've chosen to fight for people who are not able to fight for themselves a lot of times, or their voices are quietened because of their socioeconomic status or just their inability to take on that big monster, which is inequity. So thank you for doing that. I want to ask you, because I'm going back to the top now, why did you enter into the profession of nursing to begin with?
I didn't want to be a nurse. My mom is a nurse. My mom
Yeah.
is like my hero, my walking hero in life, absolutely my best friend. However, I didn't want to be a nurse because she was a nurse, and I felt like someone would be like, "Oh, she didn't give her professional career thought. She just followed a path that was like narrated for her." So I
Yeah.
fought that for a bit. Like I thought I was going to be a pediatrician because I absolutely have always loved children. And I guess I feel in that way, like God ordered my steps. Like what I
Yeah.
thought I didn't want actually became what I needed to be. I was a preemie myself. I received NICU care for about 2 to 3 months, and I think kind of going through the childhood challenges associated with being a neonate and a preemie, um, I think it really positioned me well to have the compassion that I have for my
Yeah.
community. I think when it came to nursing, I ended up having a rare blood disorder that landed me at the hospital I work at now. And when I was on the HEMOC floor, one of the individuals that came into my room, who I was really impressed by her. I love a woman that's like, she's intelligent, she's on her game, commands a room, she's in charge. And so I had a lot of respect for this individual. And I was like, I want to be like her, right? And I said, what med school did you go to? And she was like, none. And I was like, what? And she's like, I'm a nurse practitioner. At the time, I'd never heard of a nurse practitioner. I'm like, what are they? What do they do? So I was like, oh, so you went to nursing school? And she's like, yes, it's an advanced degree. And she kind of walked me through what that was. She's like, if you're interested, let me know, reach back out to me. That's this time I was 18. I was 17 or 18. And I said, okay, I look it up and I realized that they have these nurse practitioners for pediatrics. And I said, okay, that's what I want to be. So I called my mom and I'm like, hey, mom, I'm going to be a nurse practitioner. And she's like, I always knew you were going to be a nurse. And I was like, parents went to
She was
win.
just waiting. She was just waiting on you to come to it.
Yes, like of course, just constantly honoring my parents throughout my life. Like the one little strain of difficulty I could offer, I still conceded. Um, so I went to nursing school journey, and I realized it takes 2 years, right? You have to have 2 years of experience to become like a neonatal nurse practitioner to apply for a program. And so then my immersion, it really set me up well to, it's like it was a lottery style immersion that it put me at Children's Hospital of Michigan in the NICU. Like I said, it just felt like very ordered steps. I didn't have a huge hand to play in these experiences. And like I said, I went into that NICU. Like I told you earlier, I absolutely loved it. But in those 2 years, I realized that I did not want to be a nurse practitioner. And I think it was really good because I'm really goal oriented. So I'll set the goal and I'll do whatever it takes to get to the goal. Right. So,
Yeah.
you can go from a BSN program to an NP without experiences at the bedside. You can. I don't recommend it, but you can. And so that's what I would have done. I would have wanted to be on a time frame until the clause said that I needed 2 years of experience. And so when I went and got those 2 years of experience, I realized what I thought I wanted to do regarding this patient community in this space is not what I actually want to do. And would I have done it well if I ended up doing it? Absolutely.
Of course.
And what I was immensely passionate about, which is advocacy and policy, likely no. And it took me building those years of caring for that patient population to also learn the gaps. And I don't think I would have been able to fix the gaps being in that clinical space as a nurse practitioner. So I think we all have our gifts. I think we all have our passion points, and it takes some lived experiences caring for people to realize what your strengths are so that we're wrapping around each other, to all achieve our goals. So
thank you.
Yeah. Shout out to Carla. That's my mom.
All righty. That's awesome. Say hi to your mom.
I'll play this with her.
Tell her she gave us a great one. So we're grateful to her for that. All right. So we are coming to the end of our episode. I could talk to you forever because I just feel like you're so brilliant and you have so much to offer and to say. But we are going to quickly transition with our last 5 minutes to our game section. First of all, do you watch any shows, and what is your take on media portrayals of nurses?
Given that I get about 3 hours of sleep, I've not been watching.
Okay, did you ever watch any shows?
I did. I used to watch, like, what would be my favorite? Like, I really liked Heart of Dixie for a moment.
Okay. Kind of reminds me of Virgin River.
Really escaping me. I absolutely used to be normal and watch television.
And that's okay. You don't have to even remember the name of the show, just in general.
Yes, I think recently I watched what I did watch that I really loved that my mom got me hooked on, and I had to unhook myself so that I could be effective in life, was Madam Secretary. That's a recent one.
Oh, yeah.
Madam Secretary had me in a lock for a minute.
Yeah.
And
Are there any nurses on that show?
No.
Okay. Do you watch any shows that have nurses in them?
Oh, the last show that I watched that had nurses, probably Grey's Anatomy.
Okay. That's what I was asking. Any take on
like they loosely had nurses.
Yeah, they barely ever had it. I think the one nurse spoke on the episode like last season, and she's a real nurse.
I missed that one. So
they had never had one nurse speak before. I'm like, who's running all these codes?
They had the surgical nurse. They had the surgical nurse with like kind of. I feel like she would say something
Well, the Asian lady, or
one or two.
yeah, that's the one I'm talking about.
Oh,
She's a real nurse.
yes.
Yeah, but barely ever. All right. So I think we're kind of aligned on that. All right, Carlie, here we are at the end. We're going to play our game now. For those who aren't familiar with the game, I'm just going to explain it really quickly. I have a couple of genres in my jar. I'll pick one out, and you will have to come up with a plot for a show, a movie, a book, based on whatever genre I pick out of this jar.
Yes.
So you ready for this? Yeah. Okay. Okay, let's go. All right. Well, this is interesting. So your category is history.
Okay. Let's do it.
Go. Go for it.
Okay, so my storyline, I guess, would be along the lines of hidden figures. So maybe the title would be Hidden Nurses or something like that.
Okay.
And I think the reason why is because, like you were saying, undermining media stereotypes. I think starting from a historical movie that expresses the value of nursing from less of a subservient role, but in these diverse spaces that we hold, I think there are often nurses in advocacy. During the Florence Nightingale era, there were absolutely nurses and I think of like one of my favorite nurses who my late mentor, Sean Levitt, used to always call me. She used to call me Martha Minerva. And I never knew who that was. And once I learned who Martha Minerva was and her role in advocacy and getting Black nurses acknowledged during a time where the American Nurses Association, didn't allow them to be a part of it. I think that formidable voice are sort of the hidden figures of our profession. And so creating a film or a movie that the way that I felt when I saw Hidden Figures, and I was like, wow, we were a part of that, I think is the same way I would love to kind of craft out some imagery around nursing, that it's not always about being at the bedside. And if you are at the bedside, do that well. You can also do things in advocacy. You can become the next senator. You can become the CEO of an institution. It doesn't have to be the CNO of an organization. You can become your own CEO of a nonprofit or a startup. Like, I think the hidden figures behind what has made our world somewhat whole has always been at the foundation of what nursing has been a part of. And we have a lot of roles that have been played historically and present day that gets missed or misconstrued. And that's why our value as a profession has taken a beating because of it. I think that would be my kind of film, just reclaiming our power outside of what people expect of us as a profession.
That is so wonderful. And as you were talking, it reminded me of the movie called The Black Angels. I don't know if you've heard about it. Okay, wonderful. Yeah, so that really does sound like similar to what you're describing, is that historical Black nurse movement and the struggles that they had to undergo because of segregation and, their race. That's a wonderful show, and I would totally watch it. Thank you so much for sharing that, and thank you so much for being here. Where can people find you to connect with you?
I do check my LinkedIn. LinkedIn is probably the easiest way to connect with me.
LinkedIn?
For a while, I wasn't on there for a few months, but I am back, and people can message me and I will respond.
Wonderful. So we'll have all that information in the show notes. Thank you, Carlie, Martha Minerva, for being my guest today. It's been such a pleasure to have you. And guys, please be sure to share this episode, like, subscribe, and we will see you on the next one.
Bye-bye.
Take care.
Thank you,
Bye-bye.
guys.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.